Hello, and welcome back to another episode of the 2020 podcast, Canada's #1 optometry podcast. I am your host, Dr. Harbir Sayan. Thank you so much, guys, as always, for taking the time to join me here to learn and to grow. I'm so grateful for all the support, everything you do, liking, sharing, and as always, I have a request right off the top. If you do get some value from this, please do share it. Put a screenshot up on Instagram, put a link on LinkedIn, send it to a friend via text, whatever you can do to help share these important conversations that we're having. This one's going to be really impactful. If you're a business owner, or if you're involved in a clinic and you really want to help elevate the practice, this conversation is going to help take your clinic to the next level. We're going to be talking about the patient journey. And, we talk about the importance of the patient journey as a, business management type of a topic, but I don't think we go deep enough, delve into each aspect of that. And my guest, Dr. Wes McCann, is the perfect person to have that conversation. Dr. McCann, if you don't know him, is the owner of Doctors Vision Group, which owns 12 practices in Ontario. He is a prolific speaker and a consultant. He was named top 20 under 40 recognized for their business achievements. Okay, I can go on. Listen, if you don't know Wes, please look him up. He has a million accolades, and they're all very, very well-deserved. As a business owner, he is one of the most prolific people that, I'd love to bring on the podcast to talk about these different business management topics. So, Wes, thanks for being here.
Thanks for having me.
Also, awesome to have you back on. It's always nice to have you on the podcast. So before we dive in, I have to make sure I say a big thank you to the CAO as well. So we are here in Halifax. If you're watching, you see this beautiful space. We're here at the Halifax Convention Center for the CAO Biennial Congress. So big thank you to CAO for giving us the space here to record and as always for helping the profession to continue to grow. So once again, thank you. Also, a big thank you to our partner for this episode, Thea Pharma Canada. Huge thanks to Thea for just supporting, for me personally, for the podcast, for our clinic, for the profession. Thea's always been so supportive. So big thanks to Thea and for supporting this episode with Wes as well. So now, Wes, first of all, I butchered your intro, so I'm sorry. Is there
Totally
something that you think is important you want to share about yourself, a little bit of a self-intro that you want to share with the audience?
I've always been so fascinated with this profession. It is continuously evolving and exciting. So I got into it only with the expectation of taking over my father-in-law's practice and added a couple days at another practice within the first year just to fill my schedule and was offered to purchase that practice at the time. And then another practice got introduced to me and kind of continued one after one, year after year, and now we're up to 12. So it's been a lot of fun. And
I feel like you're gaining a lot of steam lately.
4 in the last year.
Yeah,
so
the last couple of years, it's been like you're hockey sticking now, exponential growth.
Yeah, so it's been exciting. I mean, it's a lot of fun. And I think my goal is always to make practices and continue to elevate them from where they already were to the next level as well, and allow us to practice the full scope optometry with the best team and best experience for patients and doctors and everybody alike. So
absolutely.
Yeah.
So I just actually did an interview with Karen Ramesh, and she's stepping away from clinical care now and more managing, and she's also acquired a new practice and all this kind of stuff. And the key thing with her was the processes, the protocols. Once you got that down pat, you can almost sort of cut and paste, copy and paste.
Yeah.
And you've got it down to a T. Like you figured it out so well that you can acquire new practices, multiple per year. Does it feel like that's what you do? You've got your protocol so well set that you can basically copy paste? Is that like 80% of it? Is it 90% of it?
Yeah, I would say maybe it's 80%. There's always nuances to every practice, perhaps what scope they're doing, what the doctors are interested in. The community might have different frame lines they tend to do better with than other ones. So there's certain things that have their own nuances to each practice, but I would say largely many of the procedures and policies that we have are very repeatable and we can copy them. So we have like an operations manual, we have a flow document, we have all these policy manuals. A lot of those are very repeatable, and some vendors, like the vendors we use for lenses, are repeatable for our dry eye products, like Thea, who's our sponsor for this. They have great products and are excellent, and so that's a very repeatable, easy option. So there are definitely things that we repeat and cut and paste, but there are certainly always nuances. So as we've grown our executive team and our administrative team to help assist that. So for a while there, I was doing probably 3 or 4 jobs, and we grew a lot in last year and added a number more people to our executive team. So that's helped to further improve just our implementation of everything as well. Yeah. So that's been great.
That's been great. So, I mean, you can't do the copy paste unless you have it really, really a really good system or systems,
Correct.
they have to be really polished.
And constantly evolving too.
And constantly evolving.
So things change, practices change. The makeup of the practice can change. The patient demographics can change over time. Oftentimes we've acquired practices with older patient demographics. And so as we've acquired those practices, certainly those practices grew with that doctor over time. And then as we grow, we acquire more patients that join the practice that are younger, more families, et cetera. So then how we're approaching those patients would look a little different than perhaps a very senior population. So it's reevaluating the practice all the time, each practice, to see what it's like and making sure you have those metrics in place to understand where you need to draw attention to.
Wow. That's a lot of practices to have to continue to oversee and evolve and all of that. That's really great. Okay. So you have all your protocols and your systems really well polished and placed in these different clinics. And a big part of that is the patient journey. And as I was saying off the top, we always say, the patient journey is really important. It's important to evaluate your patient journey and make sure you're doing a good job at each step of the way. But I don't think we dive into it deep enough. So really want to get into that with you. We'll go through all the steps that you see as the different steps of the patient journey. Where does the patient journey start for you?
Yeah. So I think the patient journey starts at trying to find an optometrist. So if you're trying to acquire a new patient, thinking about what does your brand look like? What is the brand of your practice? And whether it's a solo individual practice or multiple practices, is your brand consistent? So on your social media, to your website, to emails that you communicate with your patients, is that brand consistent? Do you have a common theme in terms of your logo and your colors and your fonts? You want to make that polished look and polished appearance apparent right from the very beginning for those patients. So that's a really important component. And finding whether you're great at doing marketing yourself or you hire an external team to do your marketing, looking at those groups or yourself in terms of what are your goals? Is it new patient acquisition? Is it growing your own patient base and maybe more internal marketing? What are you looking at doing within that? So I think focusing on that is important and revisiting that as well, because you may grow and add an associate and then you want to get more patients and you might be at capacity with your current patients. You can't add any more associates. So you want to grow your own patient base and expand what they're doing. So that outward facing brand, I think, is really important to start, because the patient journey starts with them trying to find someone to go to and what's attractive about you versus the other options that exist. And if you're in a rural Ontario city or town, there may not be many other options. And if you're in downtown Toronto, there are many other options. Right. So how do you set yourself apart from that patient journey? And it comes right down to even how easy is it to book an appointment? So can they book online? Do they have to send a request and wait for like a response and get back to you that way? Do they have to phone in? How are you communicating with your patients as well? So thinking about that patient journey and making it easy, and the type of patients you want to attract as well. So are you attracting busy people that want to come in, get their eye exam, get their glasses, get everything done in one shot and then leave? Or do you have, are you attracting more of the senior population? What patient base are you going after as well?
Right. So all your marketing will be targeted towards that type of a patient, your ideal patient or the patient you expect to have come in your office. So for the marketing side of things, your colors and your logo and all of that consistency that you're developing, you're hiring somebody for that? Or is that something that somebody would do themselves? Like, obviously when you get to your size, I imagine you need somebody else is taking care of most of that for you. But
for sure. And we had a journey along the way. So at the very beginning, I did it myself. Okay. And then I learned a lot. But then, like anything, I don't do accounting myself anymore. I'm not an expert at that. So I outsource that. And I even started outsourcing marketing when we were only 2 practices. So we're experts at what we do. Yes, we can dabble in other things. But if you really want to try to grow and create that brand, I think you need to look for a good partner that will help you do that as well. And is an expert on the subject.
Expert. Makes sense. So step 1 or the beginning, I mean, technically this is really a cycle, right? This patient journey now, but like the entry point is they're searching for somebody online and they come across your clinic and they like the aesthetic and they like that it's easy to book, and they click and they find a link you have openings hopefully this week when they're looking to come in. Great. Now what's the next step? I don't want to say what the next step is. So I'm going to leave it to you. Let's say they've booked an appointment.
All right. So what's your communication, reminders, how easy is it? So new patient, can they fill out all their paperwork before coming to the office? Or do they have to wait to get there and sit in the waiting room and fill out traditionally on a piece of paper? Right. So that was a big streamlined approach that we took in terms of getting intake forms completed ahead of time, so that a patient could complete all that. They could arrive at the office. Even a brand new patient would check in and then go straight into pretest. So it removed a bottleneck that we oftentimes had, because if a patient takes 20 minutes or 10 minutes to fill out paperwork, that puts that patient 20 minutes or 10 minutes behind, which then creates a ripple effect for the rest of the day. So we started requiring paperwork to be completed 72 hours before an appointment.
72 hours.
And when we started doing that, it drastically reduced our no-show rate and such.
Oh, interesting.
So
right.
We started seeing, and especially in a certain patient demographic age group, patients were booking appointments and not showing, especially these new patients. And we implemented a call center at our head office downtown in London. And when we implemented that, we started realizing some of these patients were calling 3 or 4 practices, booking appointments, and then not canceling any of them and just keeping the one that was the soonest. Right. So our call center, sometimes the same person would answer the phone for the same patient 4 times at 3 different practices in our city, and then realized this was becoming a problem. So we implemented that policy, and it's been wonderful for our no-show rate. Our no-show rate dropped from 8 or 9% to 2.
Wow.
So
that's huge reduction. Okay. That's an interesting point that you made on that no-show thing, though. And then somebody else has explained this to me a while back is similar. We do similar things when we're like trying to get into a restaurant. Mm-hmm. You know, we're looking around who's got reservations, and we even, now you can go online, right? I'll book a table here. Well, it's not the ideal time. It's a bit too late. So let me see if I can get something at 7 p.m. instead of 8:30 or whatever. And I mean, I try to be conscious and courteous enough to call or cancel via email or whatever. But I know a lot of people are, let's just give them the benefit of the doubt. They're just too busy and they forget, right? But it happens. It happens a lot. So when you essentially force somebody to fill out this paperwork, you're getting more of a commitment from them.
Correct. Because if they take the time to fill out their intake form, they're more likely to be coming to their appointment.
Yeah, excellent.
And there's exceptions to every rule. So you're going to have your senior patient population that may not want to fill out that paperwork ahead of time, and that's okay. We make a note, but the large rule is that, it has to be filled out 72 hours before.
Okay. So next step.
So patient arrives. Take a moment as a patient to walk through your clinic as well, to see what do they see when they walk in, where they're parking, what's the front desk like, what are your bathrooms like, all those things to think about, because those are all part of the patient experience. So take a step back to see what the patient's going to see. And then we're going to go through that experience. They do their check-in, so they have a warm welcome. If they've completed their paperwork ahead of time, then they move right into pretest and there's no more bottleneck. Mm-hmm. We're always evaluating every step of the patient journey for bottlenecks as well, because a bottleneck will change the efficiency of the patient experience and the patient journey. So we want to eliminate all those as much as we can. So patient goes into pretest. Our technicians are all cross-trained at front desk and in pretest fields, OCTs, everything. So they can do anything. So if someone calls in sick, there's not a bottleneck again. Got it.
We
don't have just a front desk person. Everybody can sit down and do that, but everyone has their side tasks. So patient journey, again, check in, pretest. Technician will take them into pretest. Technician will bring them back to an exam room. They'll do their case history, medications, color vision and stereo on our new patients or kids. They will do set up the Phoropter and get the patient ready for us to come in.
I like that. So technicians doing all of those things that you just mentioned: case history, cover test. Did you say as well?
Medication. We do NeuroLens, so that takes care of our cover
test. Is it
the
headset? Okay,
in the exam room.
Gotcha.
And then medications, color vision, stereo, and then they will set up the Phoropter. Gotcha. So we really walk in and ready to review and refract.
Yeah, got it. So case history is a nice one, because that does take up a fair bit of our time when you're having that initial case history conversation. So if the technician's already done that, then that streamlines the process even more. During the pretest, do you have the technicians asking specific questions? Or, I've heard some people suggest that's a good time to kind of prime the patient for certain things, whether it's certain types of glasses, sunglasses, or dry eye.
So they have a list of questions they go through. So did you bring your sunglasses today? Yeah. Are they polarized? Are they prescription, et cetera? Do you wear contacts? Other questions that they ask routinely: what macular supplements are you taking, or eye vitamins are you taking? Did you bring your office lenses? If they're in that age group.
Right. But some of it is like triggering to the patient. Might say, what's an office lens?
Correct.
Right. But at least it's kind of planted that seed now as something that's
conversation.
Right. Got it. And so are they doing that during pretest, or that's during the case history part of it?
So it's during the case history in the exam room. So we all work out of multiple exam rooms because, again, it's a more efficient way for us to operate, and every exam room is the same. So we don't have our dedicated rooms because when the patient arrives, they go to pretest. They're in and out of pretest as quickly as possible so that it opens up for the next patient. And then they move to the next exam room. And we will have at our downtown practice 3 to 4 doctors in and out a day. So you got to be in and out of that pretest quick so that it's ready for the next patient to come through. We will eventually get to a point where we have to have a second pretest, but
we're still able to function with one pretest given that number. That's very efficient.
Yes. So their goal time is to be done in pretest in under 5 minutes.
Yeah. I've seen situations or practices where you get to that number of doctors working at the same time, 3 or 4, and they basically have to have 2 pretest rooms. But the fact that you're still able to do that means that you're doing it in a very efficient way.
Yeah. And like we have target times and we have a flow chart we've created for patient experience as well. So when a patient's booked with this, then this is the flow chart you follow. This is the flow chart you follow for a glaucoma patient, for example, or a kid myopia management, or an AMD patient. So all of those have different flow charts, and how they're booked will make a difference as well. So for an example, if we have a glaucoma patient routinely seen every year, they will come in and they will be dilated in pretest. The technicians will look at their angles from the year before, if they were dilated the year before, any major medical changes in medication, changes in pressure. If everything seems the same, then they'll dilate those patients for us. And then they move right into visual field, into pretest, into retinal photos, and then they'll go into the room to do a workup. So if there's a bottleneck at any of those stations, then they know, okay, well, if there's a bottleneck in pretest, I'll go to my workup first, and then I'll go back and do pretest. Or I'll move to visual fields and then go back to pretest. So they know if there's a bottleneck somewhere, where can they flex, basically, and not disrupt the patient journey.
Got you. Wow, that's great. That's really great. So, okay, the tech's done the history. They've done some of those entrance tests. Now, doctor's coming into the room. Is that the next step?
Yep. Next step, doctor comes into the room. They'll do their review, chat with the patient. They'll do their refraction, anterior seg, and then dilate the patient, and then do their counseling for that refraction and anterior segment component. We found if we left all that till the end, it's too much for the patient to process all at once.
Okay.
So we like to do anterior seg. We'll talk about dry eye disease. We'll talk about any sort of refractive challenges or changes, BV issues, and then dilate the patient and then send them out to the dispensary. They've got 20 minutes to dilate while they browse at glasses, and we'll do our handover to our optical team member. So if you can do it within your EMR, or can get little tearaway pads that you can circle quickly what your recommendations are. And we'll do an in-person handover to the dispensary. At one of our offices, we use watches. So we'll page them on the watch, and then they'll come to our exam room, and we can do the exam handover right there. So
we got a bit of a pager system there. So I wanted to ask you about the handover part. So you've kind of shared a couple of different things. You can have the optician come to the room, or you go out to the optical and do the handoff there. Have you found one is better than the other, or?
I would say they're both equally effective. The challenge with the walking to the dispensary is if you can't find someone, then you're searching for someone. So that's not as efficient for me. For me, I find the best way of doing it is in the exam room with the paging system, because it'll tell me who's coming with the system we're using, and then they can arrive, but I can finish my spiel. And once they hit accept, I know I have about 10 seconds until they'll be at the door. So then I can finish my spiel, and then I'm pretty much wrapping up as they knock on the door, and then I do my handover right there.
Could you share what that system is that you use at Pager?
So we use Listo. It's a system out of the US, and in every exam room, we can have a specific dashboard where we can page opticians or OAs or anybody in the clinic or a front desk. So
everybody's wearing a
watch.
Okay.
Yeah. Unfortunately, they can't use their own watch. It's a specific watch.
I see.
But it's worked really well for us.
That's really cool. Yeah. Very cool. So handover, and next.
So then I move on to the next room. So for me, I work on 20-minute exams, but again, I have an established patient base largely, and my technicians do a lot. So and we dilate everybody still over the age of 20. I know there's some people that dilate less, some people that dilate everybody. I still find I get the best lenticular view, especially if patients got pseudo-X or any problems like that, then dilation is definitely key.
Yeah.
You can get a good retinal photo for sure, but there's lots that you don't see if you don't dilate. So we still dilate everybody, but it just, that dilation gives me a chance to move them onto the optical. They can work with the opticians there. Yeah. And then I can move on to the next room who's been worked up, or it might be my post-DFE patient.
Gotcha.
So I could probably work out of 3 rooms efficiently on that 20-minute schedule. Many of my other ODs will work out of 2, because you're on a half-hour schedule, or 15 minutes for kids and partials. So that's worked really well for them. And so we could have 2 people going on 5 exam rooms at a time. Or if I'm not in, then we use all 6 exam lanes for 3 people.
For 3 people. Got it. So for the patient now, the patients come out to the optical. Let's say you did the handover there in the optical. Is there a certain script now that your staff have to introduce them to the optical, to the glasses purchasing experience?
Yeah, so usually I'll introduce the patient to the optician and give a background on what my recommendations are. So Mrs. Jones is here. Her glasses are a couple years old. I like to write on the handover sheet if I can see what the frame brand is and the lens PAL markings. So I'll try to write that on the sheet for them.
Okay.
And then how old the glasses are roughly, and if there's a problem, scratch crazed or RX change. So again, they're primed with some more information from me. But I'll do the in-person handover explaining, this is Mrs. Jones. She's had a little bit of a prescription change. So she's going to need an update on her everyday progressive or single vision distance depending on their age. And then I'll always recommend a second pair. So whether it be sun, whether it be office lens, whether it be transitions and clear, there's always an opportunity for a second pair. So always recommending 2 or 3. And then patients usually would, if you recommend 3, maybe they'll end up doing 2 and then coming back for that third one later.
Okay.
But I think educating them on all the options and maybe the 2 that I thought they would pick, they don't pick and they pick 2 different, office and home or everyday as opposed to sun and everyday. So recommend what you think is best for the patient and then recommend that in front of your optician and then say, I'm going to let you work with Mrs. Jones for about 20 minutes and Mrs. Jones, one of the techs will grab you in about 20 minutes to take some photos once you're all done. So you've got some time to hang out here with Chris or whoever the optician is.
Right. So I think that's important there with the handover. You're sharing that whatever recommendation you've already made in the exam room now before you came out, now you're repeating that in front of the patient and the staff so that everybody's on the same page and then they take it from there.
Yep. And I like to call it also a complimentary lens consultation.
Oh, wow.
As well. So if you say that, the patient feels like they're getting something out of it as well. So they want to hear about what are they being counseled on. Because a lot of the times they don't know what kind of technology goes into glasses. So it gives them the opportunity to sit down and understand more about the differences.
Complimentary lens consultation.
Correct.
Very good. I've heard somebody else call it something similar. What does he call it? Like basically frame consultation or styling consultation. So I like that. Yeah, that makes it definitely elevates the sound of it, the experience for sure. I mean, if we're talking about the patient experience, the patient journey and elevating at different steps, using the right terminology or certain phrases will elevate it in the patient's mind, take it away from becoming just a commodity or commoditized, boring process. Now it's like, wow, consultation. Okay, this is different. Okay, great. So after the optical, they come back into the room for a DFE. Let's talk about after the DFE is done, after the eye exam's complete.
Yep. So patient will obviously go check out the front desk. If we had any dry eye recommendations, we've put them on our tearaway pad with exactly what those recommendations are. I don't hand it to the patient because the patient will put it in their purse or put it in their pocket, and then the front desk doesn't know what I've recommended, etc.
Right.
So I always either hand it to the optician if I'm doing the handover to them, or I'll hand it to the front desk and they'll get the products ready for the patient and then go over those products and when to use them and why.
So that's an important part of the patient journey too. So dry eye recommendations, you have a tear-off pad, you're writing those down. Here's the recommendations, but I make the mistake of like, here you go, Mr. Smith.
Yep.
Right? No, actually, let's go to the front and I hand it to my staff. Now they know what I wrote down.
Exactly.
And then the staff are bringing out, if you're recommending certain products, the staff will then bring those out.
Yep. They'll put them right on top of the sheet at the front desk. So they may have 3 patients lined up with their products on top of those sheets. So when they go to check out at the front desk, whoever's at the front desk knows how to consult the patient on what those products are.
Awesome. Okay, great. What's next?
So patient goes home and then it's so important that we stay in contact with that patient throughout the year. So say they come in once a year or once every 2 years, what are your touch points throughout the year? So certainly being active on social media can be one, but you're not necessarily always going to be top of mind doing that. So we've initiated email marketing to our patients as well. So in that email marketing, once a month, they'll get a health tip or something, could be a glasses frame line that we're focusing on. That will be in part of the email, and then perhaps a promotion or something in the second half of the email that will also go out to the patients. So that's really elevated our interactions with patients throughout the year because we have a really great conversion rate and acceptance rate on those. And then again, depending on the type of patient it is, if it's a family age patient, so perhaps it's a parent or a child, they'll get some email marketing on myopia management so that if they do have a child, they'll be able to have a what is myopia and then what's are the options for managing it and why is it important. And then we focus on ortho-K on the third email in that email stream for those patients. And then dry eye patients are kind of 35 to 70. And so we have that email thread that goes out.
Wow. Okay. So very targeted for different
age demographics. Yeah. And then our senior population is on AMD. So anybody 60 plus has an EMD thread. So same 3 emails that focus on different components of the disease process or what we want to focus on to educate the patient and prime them. So when they do come in, there's less of a conversation about technology and why it's important, and et cetera.
Mm-hmm. So those targeted emails that you just mentioned, the parent with the child or the adult, the senior, that's separate from the monthly newsletter type of emails that you have? Okay, so you have a monthly newsletter with a little tip or whatever every month. And in addition, you have these different streams of, and so how often do you send out those 3, that sequence of 3 emails? Yeah,
so when they have come in for their exam, about 2 months after their exam, they'll get their first one. And about 3 months after that, 4 months after that, they'll get their next one. And about 4 months to 5 months after that, they'll get their next one. So we have that cadence of emails going out throughout the year. So they'll get one a month, and they'll get 1 month that has an additional email.
Got it. So there's 12 plus just 1 plus 3. So they're getting like 15 emails a year. Is that too many? You feel like people get annoyed with that?
So our conversion rate has been great. Our uptake rate has been much higher than industry norm. So we don't have a high unsubscribe rate either. So I don't think overall
it seems like it's working.
It's working. So, but that's what I had mentioned at the beginning is always reevaluate, always continue to look at your metrics to see, do we need to pivot on our strategy? Do we need to change how we're engaging a patient? Emails would become less and less perhaps utilized by a younger generation. So are you active on social media and trying to meet them where they want to be met as well?
Right. Okay. So we went from, they found you online, they booked, they come, you do the online form beforehand, they come in, streamline the pre-testing, the tech does entrance tests and things like that. Then you do the handover to the staff. You have your tear-off pad for the dry eye stuff for the front desk. And now they've left and you have continued communication throughout the year to remind them that you're still there as their eye care provider and they know where to go. And what else is happening there?
Scheduling, I think. Scheduling is a really important part of processes that we didn't really touch on yet, but it kind of dictates some of the patient flow and patient journey as well. So if they're a medical patient, let's say, so a diabetic, glaucoma patient, et cetera, we will tend to pre-book those patients annually. Yeah. So they're pre-booked with all the testing that they need done. So if, let's say it's a glaucoma patient or glaucoma suspect, we're pre-booking them a year ahead. On my schedule, let's say at 3:00, but if they need a field and OCT, they'll be pre-booked on the OA schedule at 2:30 so that they have half an hour on the OA schedule to get all that additional testing done before they hit my schedule. So I'm not waiting for the patient. They hit my chair on time so that I can stay on time and I keep all my rest of my patients on time.
That intentional, like last time you were on the podcast, we showed briefly your calendar, right? Yeah. So you're OCD, and I'm saying that in the kindest way possible, but you're very intentional is actually the right word about how you schedule your whole life.
100%.
But scheduling patients, like I've only more recently started to become more intentional with our work schedule because like you get this sort of haphazard scheduling, then you're like, oh, we got a random little gap here. Or certain types of patients are not scheduled, like you're saying, appropriately at the 1 year mark or 6 month mark or whatever. So what advice you have on that as far as getting more intentional? That what you just said there is a really great piece, but anything else we can add to that?
Yeah, so even on your advanced diagnostics, so say field and OCT, we have to have enough staff in to be able to run all those tests and our dry eye rooms, et cetera. So things like when a patient needs an OCT or a visual field or advanced diagnostics or advanced testing like dry eye or treatments, we have specific time periods within the day that we will do that. So first patient of the day, first like 3 patients. If it's before 9 a.m., so I start at 7 a.m. I still see patients 7 to noon, 4 days a week.
Crazy.
But at like our 7 to 9, we won't have any fields or OCTs or IPLs, RFs because I don't have the staff that I can bring in for that. So when I have peak staff in, we have enough staff that can run all these diagnostics and such too, or treatments. So that way you can efficiently schedule your staff. You're not running a labor percent way too high just to accommodate having these subspecialties or managing disease. You can efficiently and effectively schedule both your patients and staff together. So I think that's really important. And having a calendar or a diary, whatever you want to call it, within your EMR with when your OAs will be tied up is important too, because you want to know if I have enough people in for that and I'm not booking a field and an IPL and a myopia management and a contact lens teach all at the same time.
Right.
That's important to make sure that schedule is very clear. And then your manager, whoever does your scheduling for your team, can see what are the demands of those days to be able to schedule people appropriately.
Right. So we're becoming part of our issue was our EMR was not the best before, and we've switched over to a much better, more robust EMR with better scheduling software and stuff like that built in, right? The diary. So we have the whatever stream for each, the doctor, the OA, the technician, whoever's all there. So yeah, just the way you recommended it, it's okay, 30 minutes with the doctor, but before that, we make sure we book the 30 minutes for the testing with the other person.
Yeah.
And then going back to the actual schedule, the staff schedule needs to make sure that we have enough people on the schedule that day. So being really intentional with all of that has really been helpful for us recently. But I've been through the process of like, it was kind of messy for a few years and we're like walking to work sometimes like, what's going on?
What am I going to see today?
Yeah, what am I going to see today? So what else on that note? And then staying in touch with your patients or scheduling wise, anything else that we missed on that front?
I think also, so your contact lens patients, ensuring that you have some sort of a contact mechanism for them for reordering or repurchasing. So are you programming your web store appropriately so that it knows when your patient should be out of their contacts and it's automating a message back to your patient to repurchase? I think we saw some great growth since we took on Auto as our online web store because it does that smart messaging to that patient to indicate. So if my patient wears daily disposables and they're 3 days a week, when will they be out of their contacts if they purchase a 6-month supply?
Got you.
As opposed to just reminding them in 6 months when they'll still have half of their supply left. So you have to make sure that you're smart in terms of your messaging because you can annoy a patient if you're contacting them too much.
Yeah.
And it's amazing the feedback we've gotten saying, how did you know I was going to be out of contacts?
Telepathic.
I'm out of contacts and I needed some more and this was very convenient. So wowing your patient in that respect, I think is important too.
That's excellent. And that's definitely part of the journey, patient journey as well, their interaction with you, being able to, just be prepared for, when the patient's going to be running out of contacts. And there are platforms like Auto and others that can help you with that. So that's really good. All right. What's the next step in the patient journey?
So,
are we at the last step?
So again, that constant contact, but also how do we stay engaged with the patient in other ways? So we've recently started doing more events. So contact lens fitting days or trunk shows, et cetera, where we can have an open house, et cetera. We've moved into a couple new locations. So how do we connect with our patients in that respect to have them in, see our new space, or identify patients? So for example, there's a new daily disposable multifocal toric coming to the market. So that hasn't been available before, anything in that category. So how do I identify those patients in my EMR and then create a special event and email market to them? Hey, you know what? We're doing this. We've selected you as a great candidate. Maybe you weren't a candidate for contacts before, or you've been in them and you dropped out, but everybody in our patient database. So how do we touch base with them and then organize that event to bring those patients in? And how do you cross-pollinate it to other areas as well? So, okay, you know what? You do this. So you also have 25% off sun on this day or 30% off or whatever you want to do in that respect. So, figuring out how do we continuously connect. And part of what we're doing with our communications to patients as well is a patient partnership. So how do we give back to the community? How do we give back to the environment? How do we give back to everything? And we hope that by doing all this, you'll also give back to us as well. So we've taken initiatives recently with certainly giving back to the community. We've done for a long time, sports teams and such and community events. But we just had all of our buildings evaluated for to be solar powered.
Okay.
So there's great government grants that are available now for that. So how do we do that and incorporate that into becoming a much more of a green practice? And then educating our patients on that as well. So again, I think patients want to invest in us if they see us as a good partner.
Right.
So the more you can show, hey, we're trying to be a partner to you, to the community, and to the environment, can you be a partner back to us?
Yeah.
In many different ways.
That's amazing.
Yeah.
Amazing. Excellent. Yeah, I think the events part is a really nice way to stay in touch with patients and give back a little bit in a way. And then being involved in the community, as you said, being more prominent and present in front of your community, knowing that you're involved is really helpful.
Yeah.
That's excellent. So have we covered the whole journey or is there something else that we're missing there?
I think we've covered most of the journey. I mean, again, when we had mentioned about calling in to book an appointment or booking online, those are all different ways we have to interact with our patient. So how do you tailor that the best within your practice? So there's people listening that'll be a single doctor practice. There'll be a 6 or 7 doctor practice. There could be multi-location. I think even in a 6 or 7 doctor practice, you could take your phone calls out of your main front desk and put them into a different room, a different building, however you want to make that look, and have a call center, because that has really made the patient journey more efficient and effective as well. We went from our average wait time on hold 40 seconds across the organization when it was at the front desk, because as you know, probably you go up to the front desk to hand off and the person's on the phone and they have to put people on hold when somebody's checking out constantly. Then you drop calls, you miss people. So we went to a call center at our head office downtown, in London, and we've been able to, with 3 people, manage all incoming calls for 9 clinics.
Wow.
And
that's all it takes, huh?
It's all it takes. It's unbelievable how efficient you can be when everybody when that's all you're doing. Well, they have their side tasks of invoice reconciliation and different things as well. So they all have their own side tasks. But it's amazing how efficient you can be when you have 3 people just fully dedicated to the phones all the time. And our wait time went down to under 18 seconds.
Wow.
So it's amazing when you do make that efficiency occur. So even in a 6 doctor practice, you could probably have 2 people that could manage most of those incoming calls.
Yeah.
And if they don't have the distractions of people coming up to them or patients having to check in and check out, then you can really refine that patient experience as well.
Amazing. Awesome, Wes. Thank you so much for sharing all of that. That's super helpful. I think no matter, as you just said, whether you're a single doctor, a large single location or multi-location, there's something in there that I know is going to be helpful to anybody who's watching and listening. Now, there's likely going to be somebody on the other end of this who's like, that's a lot. That's a lot of stuff, right? That is a lot of stuff. And it's probably too much to try to digest all at once or try to implement all at once. So pick one, that's always the best way to go. Is just pick one. I think, take a step back, first of all, and from your patient's eyes, look at what the journey is, and then see maybe where's the largest pain point or the largest bottleneck, most like bang for your buck, one change that you can make, and start with that. Would you agree?
I would 100% agree. And this has been an evolution over the last 10 years of us slowly changing things, slowly adding things.
Yeah.
I think ensuring a good starting point would be ensuring that all of your doctors and staff are on the same page for policies, procedures, get an operations manual going, get policy documents together for myopia management, for AMD, for Plaquenil, for glaucoma, so that everybody's on the same page in terms of management. You don't want a patient coming in and Dr. A has treated them with X or with such cadence of OCTs, and their friend came in and saw Dr. B, and they're treating them and managing them entirely differently.
Right.
Same disease. And you have to be able to make sure that you have that same approach. Myopia management would be a great one. So if one person's doing all the measurements within the clinic and someone else is managing them but not requiring them to do those extra measurements for myopia management, that gets out to the patient population and there's confusion and then frustration. So make sure everybody's on the same page. And then your staff will be very appreciative, because we try not to make different procedures for every doctor within the clinic because it gets to be too difficult for the staff. And we all have to agree on, hey, what's going to be our method of management for patients that we can all agree on that we think is best for the patient outcome.
Yeah. Yeah. We've made those mistakes of each doctor sort of does things differently. And at our last office staff meeting last week, the staff was voicing that to me. And I was like, okay, guys, I'm taking this off your plate. You shouldn't have to at the front have to figure out, okay, this doctor likes this or this doctor likes this, and then it's slowing down the whole process.
Yep.
So I went to the doctors. It was contact lens fittings and follow-ups. And I was like, guys, this is it. Now you deal with it, right? Yep. Don't give the staff this headache. Yep. So we're trying to actively fix some of those problems within our own practice.
Yep.
So
that's a great starting point.
Yeah. So excellent. So thank you again, Wes. Appreciate all the insights. Thank you to Thea Pharma Canada for supporting this conversation and this episode, again, for supporting the podcast and our profession overall. Thank you to the CAO for giving us this space here in the beautiful Halifax Convention Center for a CAO's Congress this year. And thank you to everybody who's listening and watching to the 2020 podcast, Canada's #1 optometry podcast. I'll see you guys in the next episode.